775 members, thank you for taking the time to get on this call today. I know folks are busy, and so I am going to get straight to the point here, which is that there is a real threat that the money that pays for the care we provide could get cut by Congress. If you've spent much time as a caregiver, then you probably know that basically all of the money for the care we provide comes from Medicaid. So when our clients get hours, that's Medicaid money. When we get paid, that's Medicaid money. And right now, folks in Washington, D.C. are talking about making serious, deep cuts to that funding. And they've gone beyond just talking. They have now voted to build a budget that would mean huge cuts to Medicaid. And I want to be real clear that this isn't something that's just happening over there that probably won't affect us. If they are going to do what they're talking about doing, then it would mean a lot of people in this country would lose health care. It could mean cuts to hours for folks we care for. It could mean some of them would lose their access to home care entirely. And it could mean cuts to everything we have worked so hard to build over so many years. Cuts to our pay, cuts to our health care, cuts to our retirement. And I wish that I could tell you that there was some real good reason why this was necessary. But the truth is that they want to make these cuts so that they can pay for tax cuts for billionaires. They are going to try and take away health care from millions of people so rich people can pay less in taxes. And I also want to be real clear that this is not just me speculating on what they are going to do. Right now, in Washington, D.C., the United States House of Representatives is working on building a budget that would cut $880 billion from Medicaid. This is real, and this is right now. So I want to tell you a few stories of the members of our union and what they have to say about how these cuts would affect them. Our member, Janie Navarro, who lives in Yakima, takes care of an elderly client. And he has diabetes and a whole lot of other health issues. Janie's client was just in the hospital with internal bleeding, and his diabetes was real out of whack. He's back home now, but Janie says, look, he can't get by without care. He can't hear, he can't see well, he forgets all sorts of things. He can't manage his own meds. Janie says, it scares me to think about what happens if he loses hours due to Medicaid cuts, because he already doesn't have what he needs. And the scary truth is, this is not just about losing home care benefits. A member of our union named Nellie, who lives in Sunnyside, is a caregiver and also works in medical transport. So she drives folks to things like their appointments for dialysis and for chemotherapy. Medicaid pays for these rides, and if that went away, then folks couldn't get to these appointments that their lives depend on. Nellie says, look, even if they could find a way to get to their appointment, if they lose health care, then none of my patients, none of us, can afford to pay for dialysis and chemotherapy on our own. Essie Frank is a member of our union from Fairbanks, Alaska. She's been a caregiver for 30 years. And in Essie's household, her mom and Essie and her daughter are all on Medicaid. They rely on Medicaid for their health care. Her mother is a breast cancer survivor who's in kidney failure. Essie's daughter, who's 18, has a rare stomach disease. And Essie doesn't pull any punches here because she knows that it would be absolutely devastating if her mom and her daughter lost health care. Essie says, this is not just about people losing jobs. This is not just about people losing health care. This is about people losing lives. And Essie went with a group of other caregivers who are all members of our union, all the way from Fairbanks, Alaska to Washington, D.C., to talk to members of Congress, to tell her representatives what these cuts would mean to her and her mom and her daughter, to look them in the eye and talk about consequences. And I share Essie's story because this is what we have all got to do. I have talked about problems, and now I'm going to talk about what we're doing about it, because our union is not just going to let this happen. All of the members whose stories I just told, Nellie and Jamie and Essie, they all went to Washington, D.C. and looked their representatives in the eye and said, hey, you got to know, if you make these cuts, that's going to hurt real people, including me and the person I care for. This is a moment when we all got to do our part to fight against these cuts. This is exactly why caregivers have a union, because we can do together what none of us can do alone. Because when it's just one person, change is real hard, but we are not one person. We are 55,000 caregivers strong across Washington and Alaska and Montana, and we are not going to take this. We are going to fight like hell against these cuts. So there's a lot going on. Our members in Washington, Alaska, and Montana, and SEIU members across the country are doing roundtable meetings with their representatives. They are sending in postcards. They are going to rallies. Some folks are even going to Washington, D.C. to meet with their representatives. Obviously, not all of us can go on a plane and head to Washington, D.C., but all of us can do something. Tomorrow is a national call-in day. We are asking folks, everybody who heard me on that call, everybody who watches this video, call your member of Congress. Tell them not to cut Medicaid and why that would matter to you. It is a quick and easy thing to do. It takes like 3 minutes, but if thousands of caregivers do it, it can have a real impact. So grab a pen, hold the line here. After I wrap up, Lucy's gonna come back on and give people details. Calling your representative is something anyone can do. If you live near Yakima or Spokane or Issaquah or Vancouver or Missoula, you can come to a rally that you are planning. Watch your email for details on where and when, and we're gonna keep you updated on what folks can do as we get further into this fight. So, as I wrap up here, I need folks to understand a couple of things. One, we can make the difference here. The margins for this vote are very, very close, and Republicans in Congress can't lose very many votes or this won't pass. So that is our job, to try and persuade just a few Republicans in the House that these cuts will hurt people. And look, here is the reality. There are tons of good folks in Washington, D.C. that we have helped elect, who have our back, who are gonna vote the right way on this, and we have to let them know that we have their back too. And the other thing that you should know is that if you're listening to the news on this, there is a phrase that you are going to hear again and again and again. And that phrase is waste, fraud, and abuse. Folks are trying to say that these cuts won't hurt people, that this is just about efficiency, that this is about getting rid of waste, fraud, and abuse. And I don't need to tell you that there is no waste, fraud, and abuse in the care we give to our clients. And in fact, if anything, we need more time to care for our clients, not less. They want us to believe that this is about waste, fraud, and abuse so that they can cut people off health care, to give tax cuts to billionaires, and they are hoping that we won't notice what's going on until it's too late. But we are calling their bluff, and we are saying, the work we do is important, the care we provide is important, folks having health care is important, and we're gonna fight like hell to protect all of that. Let's go get her done.